It's the cancer that claims more lives than breast, colon, and prostate cancer combined. Today, we're talking about lung cancer, the world's deadliest cancer, and why it earned that title. Welcome back to MedFacts, the channel where we break down diseases and health conditions in a way that's actually easy to understand. No scary textbook talk, just facts, with a little humor along the way. If you haven't already, go check out our previous video, What is Cancer? We covered the basics of how cancer forms and spreads, and everything we talk about today is going to build directly on that. So, what is lung cancer specifically? Like we talked about in the previous video, cancer happens when cells in the body start growing uncontrollably due to DNA mutations. With lung cancer, this abnormal growth begins in the cells lining the airways or the lung tissue itself. There are two main types: non-small cell lung cancer, which makes up about 80 to 85% of all cases and tends to grow and spread more slowly, and small cell lung cancer, which is less common but far more aggressive, growing and spreading faster. Lung cancer's connection to smoking is one of the most well-documented relationships in all of medicine. It wasn't until the mid-1900s that scientists definitively linked cigarette smoking to lung cancer, despite tobacco being widely used for centuries before that. Once the data came out clearly in the 1950s and 60s, it completely reshaped public health policy worldwide. Today, smoking remains the leading cause, responsible for around 80 to 90% of lung cancer cases, though it's worth noting that non-smokers can and do develop lung cancer too, often linked to radon exposure, secondhand smoke, air pollution, or genetic factors. Let's talk numbers, because lung cancer's global impact is honestly staggering. In 2024, there were nearly 2.6 million new lung cancer cases diagnosed worldwide, making it the second most commonly diagnosed cancer overall. But here's the number that really matters. Lung cancer caused about 1.9 million deaths in 2024 alone, making it the single leading cause of cancer death globally, responsible for roughly 1 in every 5 cancer deaths. That's more deaths than the next 2 deadliest cancers combined. So what are the warning signs? This is where lung cancer becomes particularly sneaky. Early stages often show little to no symptoms at all, which is a huge reason why it's frequently diagnosed at a later, harder-to-treat stage. As it progresses, symptoms can include a persistent cough that won't go away, coughing up blood, chest pain that worsens with deep breathing or coughing, hoarseness, unexplained weight loss, shortness of breath, and recurring respiratory infections like bronchitis or pneumonia. If you've had a cough lasting more than a few weeks, that just won't quit. It's genuinely worth getting checked out rather than brushing it off as just a lingering cold. Now here's where we get into treatment, and thankfully, this field has advanced enormously over the past couple decades. Treatment depends heavily on the type and stage at diagnosis. For early-stage cases, surgery to remove the tumor is often the primary option. For more advanced cases, treatment usually combines chemotherapy, radiation therapy, and increasingly, targeted therapies that attack specific genetic mutations found in some lung cancers. Immunotherapy has also become a genuine game-changer in recent years, helping the immune system recognize and attack cancer cells far more effectively than it could on its own. Survival rates have been steadily improving, especially for cases caught early, which brings us to the most important part of this video. Prevention. Because with lung cancer, this is where you have the most power of almost any cancer type we'll cover in this series. Not smoking, or quitting if you currently do, is by far the single biggest thing you can do to reduce your risk. And honestly, the benefits start kicking in surprisingly fast after quitting. Avoiding secondhand smoke, testing your home for radon gas, which is actually the second leading cause of lung cancer overall, limiting exposure to workplace carcinogens like asbestos, and maintaining good overall respiratory health through regular exercise all help lower your risk. For long-term smokers or former smokers, doctors also recommend low-dose CT scans for early screening, which have been shown to catch lung cancer at much earlier, more treatable stages. Look, I'll be honest with you. Putting these videos together takes a lot out of me. The research, making sure every fact is accurate, writing it in a way that doesn't feel like a boring biology class, editing it all together. It's a lot of work behind the scenes. But I do it because I genuinely believe health knowledge matters. And honestly, I do it for you. If this video taught you something today, do me a favor and hit that subscribe button. It might seem small to you, but it means everything to me. And it's the exact reason I keep showing up to make these videos. Drop a comment too. Tell me which cancer type you want me to cover next in this series. And as always, if symptoms persist after 3 days, please consult your doctor.